Hi everyone, it's Dr. Kinga Porter from Whole Health, and let's talk about fatigue today. Low energy levels of fatigue are actually one of the most common complaints that we get in patients coming in to primary care physicians. Unfortunately, fatigue is also one of the most complicated diagnoses to deal with. The reason for that is there are so many possible things that can cause low energy levels. And this goes from having not enough sleep or not exercising enough, being too stationary, to more complicated problems like hypothyroidism, Hashimoto's, anemia, nutritional deficiencies, obstructive sleep apnea, MS, and the list just goes on and on and on. Really the key to diagnosing what the true underlying issue is a good physical exam and then lab testing. You can't really figure out what's going on without eliminating a lot of those differential diagnoses and knowing what's going on in your body. So if you're experiencing symptoms of fatigue, I would highly encourage you to go see your physician, get some lab tests done, and kind of start figuring things out. It's not always simple. Sometimes it takes more than one blood test, but it's something that we can figure out pretty quickly. So what are the easy things we can do to eliminate fatigue? One of the most common reasons for fatigue that I see in my practice are going to be nutritional deficiencies. I would say that a lot of people these days are deficient in their B vitamins, and this comes from a poor diet or standard American diet, which the acronym is SAD. It is a pretty sad diet, and we tend not to get very nutrients dense food from it, so therefore you develop deficiencies. As we age, our absorption of B vitamins decreases, so age is also a contributing factor to B vitamin deficiencies. Numerous medical conditions such as celiac disease and other autoimmune or inflammatory conditions of the intestinal tract can decrease absorption of B vitamins. Leaky gut is really hip right now, and that's one of the things that can decrease absorption. And then there are things such as an MTHFR mutation, which is a genetic mutation that prevents your body from being able to take the B vitamins from the bloodstream into the cells. And the only way we can figure out, even with a B vitamin deficiency, what's the underlying issue there is, once again, blood tests. Sometimes stool studies are necessary as well. So everybody always wants to know, well, can I just go to GNC or CVS and get a regular B vitamin? And the answer to that is, well, it depends. Depends on a couple of things. How good of a quality vitamin is that? Is it an oral vitamin that requires gut absorption, or is it a sublingual vitamin that gets absorbed by the veins under your tongue? Then dosing matters. How much do you need as an individual, and then what barriers do you have to absorption? I do put a lot of my patients on IM or IV infusions of B vitamins, and the reason for that is you can get the blood levels up a lot quicker. I can assure that whatever I put in doesn't have to go through the gut, and I don't have to worry about absorption, and people just feel better a lot quicker. So if you are taking an intramuscular injection of B vitamins, sometimes people say, well, how long do I have to stay on that? And that also depends on the exact scenario. If your B vitamin levels are really low, you're going to need more injections to bring the levels up and to feel better. And then depending on what's actually causing the deficiency will determine how quickly you're going to get depleted again and when you're going to need the injections again. Then there's another easy thing we can do to improve our energy, and that's sleep. Sleep hygiene is extremely important, as REM sleep is when our body actually regenerates and our brain regenerates. So more about sleep hygiene at our next lecture, so stay tuned for that. But the other thing we can do in the meantime for energy is exercise. Everybody always says, well, I'm too tired to exercise. A lot of it is being motivated enough to get out there and get in a routine. Once you get into that routine and start exercising regularly, our bodies actually make epinephrine, testosterone, human growth hormone, all good happy hormones that are made by exercise, and will in turn make you feel better and more awake long term. So I do encourage you to get out there and start exercising, start sleeping better, and go to your doctor if you are having symptoms to get tested to make sure you know what can be done to prevent the fatigue. So if you enjoyed the video, subscribe and follow us both on YouTube and on Facebook, and stay tuned for the next lecture on insomnia.